Hello, everyone, and welcome back to the podcast. Today, I'm joined by Paul McRae, a healthcare transformation leader whose career has spanned investment banking, healthcare technology, digital transformation, cloud innovation, and growth leadership. Paul, it's great to have you with us today. Welcome to the show.
Thank you. Thank you for having me.
Paul, you've had a fantastic career journey and eventually you moved to the healthcare technology and transformation. Can you just take us through that journey and some of the key moments that shaped your career?
Yeah, absolutely. I describe where I've currently landed as I finally figure out what I wanted to do when I grew up. It started off after leaving Cornell, where I went to work on Wall Street. And as many econ majors end up in finance or in some deviation from that line. But over the course of the first half of my career, it was largely about understanding business and technology. And generically speaking, I worked with the military for a period of time. I worked with big organizations. I did some outsourcing at one point. And what I ended up doing around 2007, 2008 was I found where my passion was. I grew up in a household of a physician and I've been married to my wife for 20 plus years now. And her father was also a doctor. So I've been around medicine my entire life. And so what really happened for me is where I began to understand how my previous experience looking at finance, generically technology, some of the operational challenges of large enterprises, I began to see how those same dynamics applied within the care setting, particularly with the provider side. After spending the early part of my career in healthcare, specifically focusing on providers, then I started working with the pharmaceutical and then later the payers as well. But a lot of it is similar in the sense that there's large volumes of data, very different from manufacturing. If you get this wrong, it's critical to someone's health and potentially loss of life. There are technologies that can benefit the industry that are not readily or at scale being deployed within those environments. And so while I've worked with manufacturers and defense contracts and large organizations, healthcare was definitely behind the curve as it relates to implementing or deploying those types of solutions. So for me, that's where my passion began. Let's take the things that I've been doing for 10, 15 years at that point in my career and then apply them to the challenges they're facing in healthcare. And realistically, those challenges kind of span beyond just where's your data stored, how are your applications being run, but more so critical to the sustainment of the business is the fact that most healthcare organizations from a provider perspective operate on a single digit margin. So it became a passion of mine to figure out how I could apply that technology and those experiences to the care delivery side of the conversation.
Thanks. And you spent years helping healthcare organizations adopt technology and drive transformation. But maybe I would like to touch upon a little bit on the healthcare transformation gap. One thing we often hear is that healthcare organizations spend millions on technology, yet many of these transformation initiatives they fail to deliver their expected outcomes. Like, why do you think that happens?
Yeah, there are a variety of reasons. The majority of my time in healthcare specifically was focused on large IDNs, HCA, Kaiser, Intermountain, Advent Health, et cetera. And the dynamic that you described doesn't create as much of a challenge if you're a multi-billion-dollar healthcare organization. And so there's a willingness to test and try and evaluate different technologies. And oftentimes it's very siloed. The surgical team wants to try a new way to capture notes. The imaging team says, let's move the images into the cloud. The CFO's organization says, we need to bring all of our data into a data lake, but there really is no strategy. And so the absence of why I believe is that there's really no clear defined roadmap about how the technology is being applied. And then when you move down the ecosystem, and I mean by down is Kaiser, Advent Health, it'd be rare that you'd find one of their systems or one of their acute facilities that has less than 300 or 400 beds. When you move down the curve into the smaller, what I refer to as community health, rural health organizations, they don't have the luxury of making a $500,000 investment and getting it wrong. So the dynamic is the other way in the sense that because of the high hurdle of investments, nothing is done. And so what you find happens is individual small projects try to band-aid things together, which potentially has the potential to create more problems and more challenges. And so the absence of a holistic view on what's our current state, what's our end state, what we would like to be, and then what are the methodical steps in between to get us to the other side of the conversation. That's very absent from even the larger systems. There may be some individuals within the organization that has a vision, but the vision is not always clearly distributed across the ecosystem or the organization. In the smaller systems, generally speaking, they don't have a CTO, they don't have a strategist. You may have a CEO that's been in the seat 10, 15, 20 years. And in many cases, the CEO or still is a doctor, but may have been practicing medicine. And so they understand how hospitals run, but don't necessarily understand technology. And so now you're relying upon the CIO or maybe who's made some investments into understanding the technology, but still is very small when you compare it to the grand scheme of things on how the technology can impact the business, not lead with the technology, but to understand how the technology can help to benefit the business. And so that absence of understanding is where I see the biggest impact or non-impact, I would say, of technology in care delivery.
Another thing I would like to get your opinion on is AI is the hottest topic that's discussed in healthcare. And in your view, what should be the foundational challenges that organizations should solve before AI can truly create a meaningful impact?
Going back to my previous comment about single digit margins and revenue pressures, experience pressures within healthcare, AI is a formidable solution or formidable answer to repeatable tasks that are using a significant number of man hours or extending the task over multiple organizations. And we're waiting for a handoff of information, a handoff of data, one application to get this information, another application to process the information. Those types of workflows can benefit significantly from the implementation of AI. And so that's a more of a generic statement. When I look at AI in healthcare, I think about it really in three flavors. How do I augment? How do I automate? And where can we achieve full autonomy? Full autonomy is probably not going to happen in healthcare in our lifetime, in all areas in general. However, we do have the ability to augment, such as revenue cycle management solutions that have become pervasive in the current day or in the recent times. And this is simply looking at how you're coding, how you're presenting your billing to the payer, and how you're managing that workflow across your organization, the hospital or the care providers. And this is something where we've seen a significant growth in this space. There's a multitude of companies working with the larger systems, working with the smaller systems. This is an area where AI is proven to work. Now, other things around note captures has existed for a long time. Being able to automate your clinical notes while you're in front of the patient, and being able to interpret those notes into the clinical record, a larger ecosystem or larger software systems such as Epic and Cerner, formerly Cerner, now known as Oracle Health, have built those types of modules into their system. So it's playing a role. What I think we have an opportunity to do is really around how we're communicating across the entire ecosystem. One of the dynamics that has always been a challenge is being able to share information, communicate rapidly, interpret the information. And this is where I think AI can really make a huge impact. We already know that we can apply the technology to repeatable tasks that are taking up excessive man hours. If you could do something with two people that normally took four or three or four people, now you can reallocate those costs towards something else, whether it be staff in a cancer center or maintaining an outreach clinic in a distant location. There's a need to understand how the technology can be woven into business operations and not just on top and say, now we can get our billing out faster. We need to look at it in healthcare specifically as another assistance, another tool, another resource to add to the bag. It doesn't mean change the way we provide care or do business. It means accelerate the way we can with the technology we have. Several years ago, I was doing a speech at a mobile technology conference, and I said, if we could, and I was talking generically about technology, we're not at the if stage anymore. We're past that. We're at a point where now the technology can do whatever we want it to do. It's more so about responsible deployment of the technology. And in the case of AI specifically, we can use it to assist in the clinical engagement, but at this stage, we cannot solely rely on it. So everything that I see that's going into the care setting as it relates to AI always has a human component or a human element involved. Think of it as just another set of eyes to ensure that it's getting done. So I think AI is there. I think AI is definitely beneficial to care delivery. And I think with the responsible deployment and delivery of the solutions, it can significantly impact the cost as well as the experience and the outcome of the patients.
Absolutely. Thanks, Paul. That's very insightful. I would like to ask you a little bit about your journey with transformative health, like how you started it and the specific challenges that they are addressing in the market, in the healthcare industry.
So a couple things that come to mind. One, going back to that conversation, that point I made about single digit margins and the excessive pressures, expense pressures in healthcare. I think what generally should be consistent in every conversation, and I mentioned it briefly when I said understanding where you are. It's looking at what operations can be optimized, whether it's something as simple as minimizing your footprint in your data center and moving elements or workloads to the cloud, or how can I make better use of my data? So now it's organizing all my various disparate data sources into some type of data lake, and then applying some type of data normalization, and then applying a data model so that I can reach into the lake from time to time and understand by doing these procedures, I'm able to create this type of margin. Or if I'm able to provide one more doctor that does this, I can impact my business operations this way. So this really gets back to the holistic approach that needs to be a part of it. I try to steer clear of providing a solution in the first conversation. I want to go and discover. I understand both the experience currently being realized as well as where we need to take the business, and then methodically work through what are the roadmaps, what are the milestones that need to be applied or achieved in order to get to that end goal. And I say it in that way because it's unlike a Kaiser or an HCA. There's not $1 million check to go and do this thing. In the smaller systems, which is where my business is intentionally focused, it's more of, can I reduce my infrastructure cost by 40%? And then where can I apply those savings, net neutral in terms of my operation OpEx? Where can I apply those savings either to create more access, clinics, extending my community, hire more doctors, more nurses, buy more equipment so I can now do additional procedures? It's a holistic approach. That's point number one. Point number two, after spending 30 years working for AT&T, VMware, ServiceNow, AWS, my conversations were always within the C-suite. What I had to realize when I got into my business was I needed something more than my CIO communities. And it was almost anecdotal that I understood this in the sense that if I were to come to you and ask you about your data strategy, and your data strategy was not pinned down and you didn't have a vision yet, why would you want to talk to me? Because now I'm calling your baby ugly. And so what I had to realize early in my business was, even though I had an extensive roster of high-level CIOs, extremely talented, they did not necessarily want me nudging around in their business. But at the same time, I knew their business could benefit from some kind of strategy. First point as it relates to that is, several years ago, I was at a CHIME conference, College of Health Information Management Executives. So this is where just the pure C-suite come to participate in discussions. And the question was asked of a CIO, and the CIO's response was, my job is to keep the servers running and the lights on, the computers working. My job is not to strategize and figure out what we should be doing next. And I bring that point up because at this type of conference are only large IDN and leaders. And so if you're thinking about a large IDN, and I won't give you any specific names, but if you think about a large IDN and they don't have anybody driving strategy and they don't have anybody who's pointing to transformation, then there's a huge gap. And so what I had to learn early on in my business was I need to talk to the COO. I need to talk to the CEO because they're going to look at it in a very non-biased way and say, what should I be thinking about? And that's the conversation that I most enjoy. When you talk to an organization, man or woman as a CEO, COO, and you're saying, where do you want to be in 5 years? How do you figure that you're going to get there? And so now you're being able to weave in their goals, their desires into the conversation. As it relates to technologists, and you mentioned your show has an audience of entrepreneurs. What I find most consistent with entrepreneurs is they talk about their technology. They talk about what the technology itself can do, but they very rarely understand how the technology applies to the business that they're targeting. And so, if in fact, just say it's a mobile application or a new AI solution, yes, it probably does all those wonderful things, but what does it do for the previous systems? How does it take into consideration the training and the learning curve? How does it take into consideration the maintenance and ongoing support? So while the entrepreneur has built something fabulous, something fantastic, it doesn't necessarily translate into a good opportunity for the C-suite. What they want to hear is, how can your technology benefit my business without being disruptive to my business? Regardless of your personal understanding as the entrepreneur, it's imperative that you understand the entire landscape. Who's there? What technology is being used? What solutions that are already in place? What integration requirements that are there? And so while your technology may do all the things that you profess to do,
Right.
it probably is only about 30% of the conversation.
So, Paul, looking ahead, what healthcare innovations are you most excited about maybe in the next 5 years? If you're
I,
having
I,
this
I,
conversation in 2030 or 2031, how would you see the healthcare market?
I
Next,
think we're getting to a point now where there is an opportunity to have a broader collaborative ecosystem. And I'll use an unfortunate example. During COVID, there was an obvious uptick in upper respiratory infections, but there was no way to share that information across the United States, across the city that you live in. And so everything was very much siloed. And there is a privacy issue there. There is a competitive concern around being able to share your data, et cetera. But now, as an example, with the use of AI, we can de-identify the data. We can share that data in a way in which others would be able to benefit in their systems that are not being currently directly affected. So I think AI is the first play. The second play that I see is going to be more cloud implementation or more cloud solutions. And this minimizes the need to maintain a data center, minimizes the need to understand how do I keep these servers running while at the same time I should thinking about standing up a new facility or extending services out to my patients or my clinical community. So there's going to be a move, there is already a move rapidly towards the cloud. Data utilization. Up until about the last 5 years or so, the primary focus was on clinical data. So everything that lived in Epic, Cerner, Meditech, Allscripts, Greenway, et cetera. And now, in my recent conversations, when we were talking to the C-suite, they want to understand operational data, ERP data, and how you can utilize that in conjunction with your clinical data to have a better view of what's operationally happening in your care system. So at this stage, I think we're on the preface of those technologies being implemented. And then once we are able to reduce the cost of care, now we've eliminated the duplicate applications, We move things to the cloud so we can operate more seamlessly. The next hurdle to be embraced in healthcare is security. And so, as it relates today, when you're managing your security environment as a healthcare system, that's one or two men or women doing the job. If you move your stuff to the cloud, you move your workloads to the cloud, now you have the benefit of thousands of workers within the hyperscaler environments monitoring your environment. So now we are able to do more things, extend our services in more ways, and then ultimately be able to provide a better experience for the patients, better experience for the clinicians, and then overall reduce the cost of providing care to the community. So all of these things will have an effect independently, but at the same time, it does require a subjective approach to each system.
And just coming back to transformative health, what's your 5 year strategy? Like, where do you see it in the next five, next 10 years?
We'll continue to grow. We worked with some smaller healthcare systems now. We're doing some projects. What I want to do is to keep replicating myself, keep expanding our organization. If you look at the acute healthcare systems, there's roughly about 6,700, 6,500 healthcare systems in the United States. Only the top 600 or top 10% are the targets of the large SIs, large software companies, et cetera, which means the other 6,000 don't get a lot of attention. And so what we hope to do is we're doing it regionally now here in the Southeast, and then we have some activity across the country, and then there's some things I'm working on in Canada. But what we hope to do is to continue to replicate ourselves in those engagements and take them to other healthcare systems. And for me, there's a personal passion there because if a large IDN gets it wrong, then it's a bad investment. Maybe even worst case scenario, they replace the executive who led the project. If a smaller healthcare system gets it wrong and they're in rural America, Jersey, Missouri, Alabama, wherever it is, now the entire community using that health system has to now drive an extra 100 or 200 miles just to get care. And this becomes an additive problem because now patients don't go to the doctor because it's too far, which then drives up the cost of addressing that particular condition, which then causes another lever to be pulled in the economics of care delivery. And it's just a bad cycle that I hope for us to be, I hope that Transformative can be a part of solving. That's my goal.
Great, Paul. Thank you so much and all the best for transformative health. And I hope it meets the goal. And this has been a very insightful conversation. We explored your journey from investment banking to healthcare transformation and why so many, you also told like why digital initiatives struggle to deliver meaningful outcomes. And we also learned about the mission behind Transformation Health. Thank you so much for joining us and sharing your insights with our audience.
Thank you for having me. And please reach out if there's anything else I can offer.
Thank you. Thank you. Thank you.